Hello, my dear. I am so excited you're joining me for this Neuro-Fascia mobility class. I'm excited when someone is taking on the opportunity to learn about the body and to learn something different. It's educational and it's an opportunity to tap into your body and discover something new. This class is about knee health. And as we know, knee problems generally are not a local issue, which means we need to focus on the areas above and below. For example, in the hip, we want to make sure we can come from external into internal rotation, or from lateral into medial rotation, and in the foot from pronation into supination. What you need is a towel, ideally short pants, so you can use the towel directly on your skin, and something to sit on. I use a bolster, you can use a block or a pillow. So take your towel and fold it a long way, and we begin to open the superficial fascia of the base of the foot, traveling up to the heel, and then moving up to the Achilles tendon. This is just a light, gentle rub and an awakening of the receptors of your superficial fascia. So traveling up and down the leg a few times, and then take the towel to the top of your foot and just give the top of your foot, the fascia of your toe extensors, a little rub, traveling up to your retinaculum, and then moving up the shin. Also go a little bit outside to the fascial bag of the tibialis anterior, and now a little bit under the knee, right on the kneecap, warming up the tissue just above the kneecap, and then traveling up your quadriceps muscle. Now move a tiny bit outside towards the IT band and tensor fascia lata area. You may want to extend your leg a little bit and even travel further up right to your hip bone. And then down again, top of the knee towards your retinaculum, top of the foot, top of the toes. You should feel already a difference. If you like, you can stop the video and stand up and go for a little walk and feel it. What we do now is take the towel behind your leg and then hook the towel onto the Achilles tendon, so to say, pulling the hands forward and up, and then drag the towel up as you extend your leg, pulling the hands now up towards the ceiling, a deeper contact to your neuromyofascial structures, and then all the way up to the hamstrings. Let's do that again. From the back of the leg all the way up, back of the knee, and then towards the sit bone. Now take the towel just below your knee. Give your towel a little bit slack so the hands are parallel to the knee as you move up. So pulling the hands up to the ceiling, pushing the hands into the sides of the knee, and now drag the tissue up as you push into your hands and extend the knee. So lateral, we have the IT band attaching just below with, the tensor fascia lata feeding into the IT band, and medial, we have the adductor tunnel and also the pes anserine. Now slowly pushing the hands into the sides, finding fascial mobility here, awakening, pushing your hands into the side, awakening and livening, hydrating the fascia of the back of your leg and your knee. Let's do the other side. Rubbing the base of your foot, traveling towards your heel, a little light rub, and then moving all the way up to the backs of your knee, and then up your thigh, and then back down. Let's do that one more time. Traveling up, a light rub, and back down. And then coming to the top of your foot, top of the toes, a gentle stimulation of the receptors that are also responsible for proprioception, or awareness of where is our body in space. And then around the knee again, traveling up. Now down to the outside of your leg, the fascial bag of tibialis anterior, and then below the knee, where the knee bridle, the quadriceps bridle, fascially attaches just on the tibia. And then on top of the knee, and then above the knee, all the way up, slightly lateral, tensor fascia lata, IT band. We're going to the outside. Good. A little bit on the inside. Your adductor group lives. And then bring it down again. Take the towel behind your leg, pushing the hands into the leg a little bit stronger, and then dragging the towel up a little crack here, as you move the towel up towards your sit bone. You can also do a lateral rotation, medial rotation. Let's do that again. Pulling up, a bit of movement, varying movement into the leg, up to the sit bone. Now take your towel just below your knee. Give your hands so much towel that they are parallel to the knee as you move it up. Pull the towel up against the back of the shin, gastrocnemius, and then deeper all the other muscles like tibialis posterior. And then now we go to the back of the knee, and just go as gentle as you need to. There's a lot of nerve bundles, and you drag it up. So behind the knee we find popliteus, part of the deep front line. And then just drag it up. And as you drag it up, you push the hands into the side of the knee, finding medially, adductor tunnel and pes anserina laterally, just below the knee, the attachment of the IT band. And opening up the fascia of popliteus, which is responsible to bring our knee out of extension. So the next exercise is an atherokinematic, a bone rhythm exercise. So what happens is when we bend our knee, because of the shape of the bones, our tibia moves medially, so it rotates inwards, and our femur rotates outwards. And we want to make sure that this is happen appropriately. And here now, with this next movement, I guide you through a little bit of encouragement to allow the bones to have this rhythm. So you have your knee slightly extended, and then as you bend your knee, you draw your femur bone out and your tibia fibula in, and then go back. And as you bend the knee, top hand goes outwards, bottom hand goes in. And that's just a gentle drag, so to say. And then every time you bend the knee, bottom hand in, top hand out. A few times more to ensure proper extension of the knee, which is necessary for one of those phases in gait and also in athleticism. Many movements. Let's do this on the other side. As you bend the knee and bring it from a slight extended knee into a more bent knee, you draw the bottom hand in and the top hand out. And again, finding the appropriate bone rhythm, but got out of rhythm here, of the knee joint. So as you bend the knee, the bottom hand draws inwards, medially rotates the tibia, and the top hand laterally rotates the femur. Wonderful. Okay, now come to a standing position, finding center on your feet, in your pelvis. Lift one leg up and swing it forward and backwards. We're doing a little knee joint mobilization exercise. Also to allow the brain to understand that it is safe to go into different direction. From left to right, right to left, and then make circles. And you will see the more often you will do this, the more natural and less clunky it feels. Change direction of your circle. And then the standing leg is doing some stability work already. The knee of the standing leg is still not hyperextended, but softly extended, responsively extended. Excellent. Other side, finding center between your feet first, in your pelvis, and then switch the other side. And just let your foot dangle off the knee and the knee joint being as relaxed as possible. The standing leg not locked, but awake. Still softly extended. And then do a sideways movement. Begin with your circles. And it's really important that you're not working into pain here, so you may want to decrease the movement and allow your brain to recognize that it's safe to go into these positions. Give it some time. The goal is to have at least one repetition without pain. And then come to standing, finding your center again. Step forward slightly into a very relaxed lunge position with one leg. And begin to circle your knee again. The foot stays flat on the ground. And you circle the knee, bringing the knee into different position. Change direction. And you notice there is also some work happening in the foot itself and in the hip. Then turn your foot slightly out and repeat. So you go into one direction with your circles, like 3, 4, 5 circles, and then into the other. Also creating glide in those myofascial structures around the knee. Getting into different position will help. Turn your foot inwards, finding a few circles into one direction and then into the other. Signaling the brain that it's safe to have some variety in movement. And the bones in the foot too, as you probably notice. Okay, other foot, step slightly forward, finding center in the pelvis, and begin with your circles. And I can feel this is a little bit more, this is my knee that I worked on for quite a while, which is fine now, but you can tell it's still a little bit clunky. And then other side. It feels safe though. And then turn the foot out, finding your circles here into one direction. Little clunk in the ankle. And then change direction, and the foot stays on the ground, big toe stays on the ground, heel stays on the ground the entire time. And then turn the foot in, finding circles again. One direction and the other way. And if you want, every time you do an exercise, just take a little walk after you did one leg and notice the difference. Good. And then coming to a standing position. That's it. Thank you so much for joining me in this neuromyofascial mobilization class. I hope you enjoyed it. And as always, send me a DM, send me an email, anything. I love to hear your progress, your changes, your discoveries. I'll see you next time.